Hi guys, I'm Dr. Kuchi and today I'm here to give you detailed information about rosacea. What is rosacea? Rosacea is a skin condition that makes your skin look flushed or red. You may have small bumps with pus inside. It can look similar to acne or other skin problems. The symptoms differs based on the color of your skin. Flushing and blushing are very obvious on light skinned people, but it's harder to see on brown or black skin. It might make it harder for people with darker skin to get the right diagnosis. But even if you don't see obvious redness, you may have rosacea if your skin has a small red bumps filled with pus, or stinging, burning, and sensitivity. Who are at the higher risk of rosacea? Rosacea can affect anyone, but some groups are more likely to get the rosacea, including middle-aged or older adults, women, light-skinned people, but doctors may overlook it in people with darker skin because this skin tone can hide discolored spots or discolored skin. Types of rosacea. There are 4 types of rosacea, but you can have symptoms of more than one of these types. The type of rosaceas are: number 1 is vascular rosacea. With this type, you have long-lasting redness on your face. Small blood vessels under your skin gets large and more visible. Your symptoms may often come and go, and without treatment, the redness can get worse or even become permanent. Number 2 is inflammatory rosacea. This causes pus-filled whiteheads as well as swollen red bumps that look a lot like acne, but it is not acne. Often they show up on your forehead, cheeks, and chin, but they can also affect your scalp, chest, or neck. Your face may also be red or flushed. If you have serious case, these symptoms can take a while to get better. Number 3 is hypertrophy rosacea or fibrous rosacea. With this rare type, your skin gets thick and scarred. This form of rosacea most often affects your nose and can make your nose look like a bulb-shaped, swollen, bumpy, and sometimes discolored. Number 4 is ocular rosacea. What is ocular rosacea? This type of rosacea affects your eyes, causing them red, irritated, and look like a bloodshot or watery. Your eyes become dry and sensitive, and you may get cysts on your eyelids. Rosacea on the face. When rosacea appears on your face, your skin will look more flushed. You may have a broken blood vessels called spider wings and pus-filled bumps. Vascular rosacea, inflammatory rosacea, and hypertrophy rosacea are all types of rosacea that appears on the face. And ocular rosacea is the only type of rosacea which appears on your eyes, and the symptoms which I have already mentioned. For people with lighter skin, the main thing you may notice is redness on their cheeks, nose, chin, and forehead. Less often, the color can appear on ears, head, or chest. For a while, broken blood vessels might show through your skin, which can thicken and swallow the skin. Up to half of people with rosacea also get eye problems like redness, swelling, and pain. Every year, 10 million Indians are suffering from rosacea. Other symptoms are stinging and burning of your skin, red or pus-filled bumps that may resemble pimples, patches of rough or dry skin, a swollen ball-shaped nose, larger pores, broken blood vessels on your eyelids, bumps on your eyelids, problems with your vision. These are all the symptoms of rosacea. Is rosacea itchy? This doesn't always happen, but rosacea can sometimes cause an itchy or irritating or irritation feeling. Rosacea's symptoms can come and go, and they might flare up for a few weeks and fade away and then come back. The treatment for rosacea is must. So see your doctor. If you don't take care of it, your symptoms get worse and might become permanent. So don't forget to consult your doctor. What triggers rosacea? Number one, sun exposure, very hot or very cold weather, alcohol, smoking, very hot, spicy food, intense exercise, stress, some cosmetic or skin or hair products. In addition, menopause and some drugs may cause flushing. Causes of rosacea. Doctors don't know exactly what causes rosacea, but a few things can play a crucial role in rosacea. These are your genes. Rosacea often runs in families. Blood vessels problems or troubles. The redness on your skin might be due to problems with blood vessels in your face. Sun damage could make them get wider or worse. Then we have mites. Mites, they are actually microscopic insects. A type called Demodex follicularum normally lives on your skin, on our skin, and usually isn't harmful. Some people though are more sensitive to the mites or more of that mites than usual. Too many mites could irritate your skin and you may end up with rosacea. Bacteria like H. pylori, it's a normal bacteria which lives in our guts that can also cause rosacea. And then something about you may make you more likely to get rosacea or have lighter skin, blonde hair, and blue eyes. People between age 30 and 50, female, have family members with rosacea, which I call the genes, had severe acne, or you are a chain smoker. Treatment of rosacea. There isn't any cure for rosacea, okay? But with the help of treatment, we would be able to manage the redness, bumps, and other symptoms. There are multiple treatments and therapies for managing rosacea. So number one is topical creams or ointments. So, and topical creams, number one is azelaic acid. Number two is bromelain gel or mirwasa. This gel actually, what it does, it tightens the blood vessels in the skin to help the bumps look normal. Then we have calcineurin inhibitors, then clindamycin, it's an antibiotic. Then we have metronidazole, erythromycin, oxymetazoline, sodium, sulfur. And then we have oral medication. Usually we prescribe isotretinoin. The brand names are Clarwise, Amnistim, and others. It's actually an acne drug, sometimes prescribed for rosacea, but don't use it if you are pregnant because it can cause serious birth defects. Then we have laser treatments, dermabrasion, and electrocautery treatment. It's an electric current that zaps blood, damaged blood vessels. Zip up. Like it closes actually. Rosacea skincare, there is a lot you can do on your own to improve your symptoms. For starters, try to figure out the things that trigger an outbreak and then avoid them. To help you do this, keep a journal that track your activities and your flare-ups. So also follow up these self-care tips to protect your skin and help fade redness. Number 1, put on your sunscreen to avoid symptoms triggered by sunlight or sun exposure. Use a sunscreen with broad spectrum coverage that it blocks UVB and UVA rays, and the SPF should be above 30 or 50. Applied whenever you go outside, and also wear wide brimmed hats so that you could avoid the sun exposure as much as possible. Number 2, use gentle skincare products like cleansers or creams or whatever like you use. Try to use without fragrance, without witch hazel or any other harsh ingredients. Then number 3, moisturizer, especially it is very helpful in cold weather when low temps and wind can dry up your skin.